Good morning and welcome to Meet the Experts, Adolescent and Young Adult Edition. My name is Cassandra and I'm a patient and family specialist here in the Patient Library and Welcome Center. We present these AYA sessions on a Tuesday or Wednesday, once a month, and today's topic is Life After Cancer Survivorship Clinic. Before we start, we have a quick disclaimer. The content in this presentation is not medical in nature, and the viewer should consult their physician should they have any questions. If you think you may have a medical emergency, call your physician, go to the nearest emergency department, or call 911 immediately. Never disregard professional medical advice or delay seeking care because you watched this presentation. And now, it's my pleasure to introduce our speaker today, Dr. Drew Gilligan, who is a pediatric hematologist oncologist. Dr. Galligan joined the University of South Florida in 2015 and began to see adolescent and young adults in the Moffitt Cancer Center Survivorship Clinic in 2017. Welcome, Dr. Galligan.
All right, so I always like to start with kind of what is a survivor because a lot of people don't know what is meant by the word survivor, and you probably have, run into that sometimes for, for anyone that's on the call or the video here or maybe watching, you might be asked like, are you a cancer survivor? What is a survivor? So I like to always start with it's not the show Survivor, although I know that show is still kind of going on years and years after it started. It's not the movie Survivor, which I still haven't seen yet, but there is a movie called Survivor. Survivor by Destiny's Child, although that was a good song too. And it's not the band Survivor, and Eye of the Tiger is a really good song too. So, kind of what is a cancer survivor? And so there is a definition from the Institute of Medicine that really that a patient is considered a survivor from the time of their cancer diagnosis through the balance of his or her life. So you'll find multiple definitions out there. Some people determine it based off of the number of years after finishing treatment, but really anyone can be considered a cancer survivor the moment they kind of, get diagnosed with cancer. Um, Typically in our survivorship clinic and most survivorship clinics around the nation or the world, we'll start to see patients at different time intervals, and a lot of it's based off of what your treating cancer doctors kind of feel as the moment to kind of switch it to more of that survivorship mode. So a lot of times that's 5 years after finishing therapy. Sometimes it's 2 years. Sometimes it's a little bit longer if there's risk for the cancer coming back or recurring. So it just really depends on when you start to see us in the survivorship clinic itself. I bring it up because from the adolescent young adults, although they make up a small snippet of all the cancers diagnosed, it's a really unique and interesting population because there's lots of cancers and diagnoses and treatments that are very adult based, and then there's some that are more pediatric based, which where is my kind of training and background too. As of probably the early part of the 2020s, the 5 year, kind of survival rate for all of adolescent young adult cancers was a little over 85%. And you can see the number of cases, just last year for adolescent young adults reached about 84,000 new types of cancers. And it's a smattering of different types of cancer. So it's not just one cancer, although, lots of different cancers will make up a huge chunk of it with breast cancer, thyroid cancer, testicular cancer, and melanoma making up a big chunk, but there's always a lot of other things like leukemias, lymphomas, renal tumors. So, it's a kind of a very interesting kind of grouping of different cancers that you can see in this age population. These slides kind of just show another way of looking at different cancer diagnosis for adolescent and adults, and then a few different graphs here, kind of on these line graphs on the side over here, looking at different age ranges from back to the 1970s to the kind of the mid 2015s or the 2010s, I guess. And really the idea with this is that really since the 1970s, we've been seeing more incidents or more cancer rates increasing, probably because we do a better job of detecting cancers and do a better job of screening for cancers. But we've also seen really, really better mortality rates as well. So you can see the incidence rates, have gotten much, much better, but the mortality rates have also, these graphs at the bottom here, have gotten lower and lower each time since the 1970s. This slide also just shows the different types of cancers and also how this adolescent adult population, changes depending on the type of cancer that you can see. So when you see certain cancers actually have a better survivor than other cancers, which we know of just because certain cancers are a little bit harder to treat overall. So really right now, kind of in the world, the survival rate for most adolescent adult survivors is kind of greater than 85% and probably will continue to go up as we get better treatments and more kind of streamlined and individualized treatment approaches. Because of this, we're seeing more and more survivors of cancer. So back in, or right before 2020, so back in January of 2019, we had about 670,000 adolescent young adults that were living in the US with a history of cancer. So, you can see that that's a huge number, and that number will continue to increase. And probably if we had current values in 2025, we'd probably be over 700,000 adolescent adults that have had a cancer at some point in their lifetime. We're seeing this because obviously I mentioned before, we're doing a better job of detecting and diagnosing cancer, and we're having much, much better cancer treatments. And this is just creating a greater number of survivors long term, which is a good thing to have because that's the goal with cancer treatment is to survive cancer treatment. However, now looking at it, curing cancer and surviving cancer is no longer just that can't be it overall. We have to kind of do better and kind of figure out how we can do better because what we're seeing is with more cancer survivors, there's a lot more potential health term kind of effects, conditions, comorbidities. And because of that, we're seeing a lot more use of cost and usage of the healthcare system because a lot of our patients that are surviving cancer have a lot of long-term health effects and they're, having to go to the doctor or going to the emergency room or having surgeries or, using, the healthcare in different kind of ways. And so figuring out how better to kind of minimize some of their long-term health effects, treat their long-term health effects, get them kind of plugged into kind of places like a survivorship clinic so that way they can help manage those long-term health effects is kind of the ultimate goal now. So our team and the cancer survivorship team, we're kind of I always say like we're kind of we're there to kind of help out. We're kind of there to kind of take over, at some point once the cancer treatment team feels that the patient isn't at risk for, recurring or relapsing. And we're kind of more focused on, we're less focused on looking for the cancer to come back and more focused on like how to look for all the potential long-term effects from the cancer treatment itself. So, like I said, most of the patients have usually completed their cancer treatment. A few times we'll do kind of what we call like, kind of these we call them oncology wellness visits, where we kind of do like a little snippet or a little bit of this is what cancer survivorship kind of life would be like, and kind of talk about a few things that we do in the survivorship world. But it's for patients that are either still on treatment or have just finished treatment to give them a little bit of a glimpse into the cancer survivorship kind of clinic world. We really focus on a lot about wellness, physical health, emotional health, and other challenges that patients kind of face throughout their cancer journey because we know not every patient goes through the same journey as anyone else. And there's lots of, road bumps, hiccups, great things that can occur, but also really challenging or difficult things that occur too. So we kind of focus on a lot of those topics throughout the cancer treatment as well. I've always put in here a plug that, June is our National Cancer Survivor Month. So obviously we're in October right now, but definitely when June comes around in 2026, there's lots to celebrate for cancer survivors. So when you think about the different kind of, aspects of survivorship care, these are kind of the five pillars or the five kind of key things that a lot of people will focus on. So things such as looking for secondary cancers, looking at the physical effects of the cancer treatment, looking at the mental or the psychological effects of the cancer treatment, how you can promote health and wellness long term, and then determining like, the development or watching for the potential development of any chronic health problems from the cancer treatment as well. We'll touch on a few of these to kind of talk about some of the highlights that we would focus on in the cancer survivorship world, just to kind of give you a glimpse on things that your team would hopefully be looking for when you see them in the clinic. Again, this is just another kind of similar slide looking at some of those same things in terms of kind of from the physical, social, psychological, and spiritual areas. And you can see the different kind of facets of those areas. And obviously, a lot of these are really, really key important things to kind of talk about. And some may be more pertinent for some patients than other patients, but it's definitely one where we try to focus our attention on what matters to the patient, what matters most. So that way we can kind of really get a sense as to how to help our cancer survivors. This slide kind of talks about a few different long-term and late effects that we think about. And I broke it down by different topics in terms of the different treatments. So you can see chemotherapy, radiation therapy, and surgery are listed here on the left, and the different kind of long-term side effects from those, and then late side effects. And there is sometimes overlap between them, but and again, it just depends on the different, there's chemotherapy is a really kind of giant bucket of, a term, and there's more individualized chemotherapy that people will receive that has more specific side effects. But you can see things such as like fatigue, skin issues, chemo brain, sexual dysfunction, different kind of side effects to different organs like the lungs, the cardiovascular system, body dysmorphism, so body image disturbances. So there's lots of different things that we kind of focus on. And like I said before, a lot of it's on what matters to the patient. So if a patient comes into me and has concerns about their fatigue, their sexual health, maybe they're just really, dr- maybe their mental health is also, they're depressed, they're anxious, they're kind of, scarred from all the therapy or the treatment that they had to go through, figuring out how to best connect them to the different teams and the resources that we can offer them is kind of the goal from that discussion. I mentioned before about kind of the chronic medical problems. So they've done a lot of studies to look at it both from a childhood and adolescent cancer populations. And it's varying depending on the study that they look at, but it shows that a wide majority of patients that survive, a cancer when they're younger will have one or more health conditions throughout their kind of adult lifehood. So some studies say up to 60 to 90% will have one or more health conditions. And of those, some of them will be severe or life-threatening health conditions. And again, it really just depends on the how they define things with the different studies. Another study looked at kind of survivors, comparing those to those that hadn't had cancer. And it kind of showed that 40% of survivors would have greater than more, we call them two comorbidities, so two different disorders or long-term health conditions compared to 20% of those without cancer. So almost a double lean effect of those that had been survivors of an adolescent and adult cancer had more kind of long-term health effects than those that didn't have cancer. We mentioned fatigue earlier, and I always kind of lump fatigue and exercise together because a lot of times, fatigue is one of those ones where it can start early with cancer therapy. It can last late, even after finishing many, many years off cancer therapy. And it says 1 in 5 adolescent adults will experience some kind of chronic fatigue. And this can be, triggered or associated with things such as, mental health conditions like depression and anxiety, pain issues, and really inferior quality of life. Because if you can't really feel rested and can't, feel like you're getting enough sleep, sometimes that affects your, ability to do a job, ability to go to school, ability to, lead a life kind of stuff. So it can really, really affect how your quality of life long term is too. Related to that, exercise intolerance has also been one. So, they always suggest like getting a good amount of, activity or exercise, especially to combat fatigue. That's one of the hallmarks of kind of the fatigue treatment is to be active. But a lot of times, cancer survivors are really, really, deconditioned from all their treatment as well. And they just don't have the tolerance to do any kind of like formal kind of exercise programs and figuring out like how best to kind of get them into an activity kind of program that they can tolerate too. This just shows kind of the benefits of exercise. And like I said, it helps with fatigue, it helps with sleep, it can really help with a lot of different things. And so it is really, really important, but kind of weighing it between like how much is maybe too much for the patient to do, figuring out what they can do, figuring out what's able to be done, is kind of the goal when we kind of discuss being active with our cancer survivors. I mentioned about secondary cancers as well. And so any patient that's had, especially adolescent adults that's had a cancer in the past, they're about 1.5 to 3 times higher risk of developing a second cancer than someone that hasn't had, cancer before too. There's a lot of different risk factors, such as, radiation, different kinds of chemotherapy, different staging of cancers. And so it's definitely one where, thinking about other cancers that can come up. So if you've had radiation therapy to like, let's say the chest or the neck for a lymphoma, the risk for like a breast cancer for female patients or even male patients, or like a thyroid cancer goes really, really high too. So, or if you've had certain kinds of chemotherapy that have a higher risk of secondary cancer, such things as like a leukemia that can develop long term, can also develop too. So kind of how we're going to monitor that, are we really worried about it? Are you having symptoms? So kind of having those discussions when we meet with cancer survivors in the survivorship clinic as well. And then kind of the mental health or the psychological effects. A lot of patients face anxiety, depression, almost like a post-traumatic stress after being diagnosed with cancer. And sometimes even like how they, they're used to being a cancer patient coming in weekly or multiple times during the week, and then once cancer therapy stops, it's kind of like, now what? They're kind of, it's hard to kind of really reprocess and figure out what your role is now and how that affects your mind and your ability to kind of go forward with things too. So other things that can occur that can make this even worse, so things such as like employment issues, school related issues, other distress that we kind of mentioned in terms of some of the mental health conditions, relationship difficulties. They've done studies to show like those that have had relationship difficulties can have longer term health effects with their cancer therapy as well. And then just poor knowledge of their diagnosis and treatment. I've see patients in our cancer survivorship clinic. And time again, I have patients where they don't really know, maybe they were too young to understand, or they had a significant other or family member that was taking on a role of being the one to ask questions or know about their diagnosis or what they were treated with. And that can really impact as they kind of move forward if that person's no longer with them, or maybe they're not there at all the visits to know what they should be asking and what questions they have for other effects long term as well. They did a study to look at the kind of the quality of life in adolescent and adult patients. Um, and what they found was a few different things. So they found that there was worse quality of life than patients that didn't have cancer. And they saw that the greatest deficits were in certain things such as like social functioning. So being able to kind of have conversations, go out and have relationships, be in crowds of people, fatigue, and then physical and emotional roles as well. And they showed a few different risk factors for those as well too. So, we know all these things are there, and sometimes it's really hard when you're getting through cancer treatment to focus on some of these effects, secondary cancers, chronic medical conditions, because a lot of times our really chief focus is on treating the cancer and on some of the short-term side effects from all the cancer treatments too. So sometimes these long-term effects get kind of pushed back to the back of the brain before we kind of start to think about them, but they definitely can come up, sometimes for patients even right after therapy or many, many years off therapy too. So that's kind of where we come in, and the need for long-term follow-up care for cancer therapy is definitely there. The question that I put on this slide is like, who does it? Where do they do it? How does it happen? Like, what happens when you do it? And there's not one model that works best. I'll tell you what we do at Moffitt Cancer Center, but lots of different places have different kinds of models, and I think not one is better than the others. But I'll show you some information about how cancer follow-up can be really, really helpful in a survivorship kind of model. So they've done some studies on adolescent and adults, and they showed that almost 90% of survivors will get some kind of medical care after finishing their cancer treatment. But when you break it down, you kind of will see a smaller and smaller snippet of cancer survivors that will get what we call survivor focused care and then survivor risk-based kind of care. So like really focusing on like the types of treatments that they got rather than just more general like care that you would get with like your primary care provider, primary care physician, which is great in and of itself, but sometimes they don't know all the side effects or the long-term effects from your cancer treatments. So like I mentioned, it really depends on when to refer someone to like a survivorship or long-term follow-up care. And it really depends on the center. Some centers have based off of how many years of therapy. Some will do it after 2 years. Some will do it after 5 years. Some will do it longer if there's a really higher risk of the cancer coming back. Places where they refer, sometimes it's referred within the same program. So at Moffitt, all of the Moffitt patients can come see us at the Moffitt kind of survivorship clinic. Sometimes if you live further away from Moffitt, it might be going back to more of like a program kind of more locally to where you're, from kind of stuff, because it might be really challenging to get back to Moffitt, for cancer survivorship care. Although I will say most survivorship care um, visits are typically maybe once a year, sometimes twice a year. So typically the burden isn't super, super high, but sometimes it is easier, especially if you live in a geographic area, to kind of have a more local kind of survivorship kind of model. And then sometimes there are different community providers, so different, family physicians, internal medicine physicians, other primary care providers that'll take on that role too, and they'll work with your original treatment center to kind of find the right treatment for you too. The big thing that we do in cancer survivorship is we develop what's called a survivorship care plan. And this is kind of a like a little snapshot of the patient's cancer history. So when they were diagnosed, the different treatments, sometimes the doses of chemotherapy or the doses of radiation, and then generally some recommendations for some of the late effects, like how to monitor for those, other health promotion strategies, and other like cancer screening. So like it'll suggest some screenings as you kind of, patients get older a little bit too. Typically, we give this to patients when they first come into the survivorship clinic itself and give them a copy and encourage, them to share it with their primary care provider, other specialists, or really anyone that they feel comfortable sharing it with. It is a living document, and so if things change, like if we find that there's new, kind of long-term effects from a certain kind of treatment, the document can be updated and changed overall. And then we modify it again based off of emerging evidence. And this is kind of a required document for really big cancer centers itself. So the Commission on Cancer and the American College of Surgeons requires this. But I feel it's a really, really important document to kind of go over and understand and kind of ask questions about. Here are kind of if you're making it really individualized, which is kind of the hallmark, we want to individualize for the specific risks that our cancer survivors are at. These are the things that we would kind of focus on. So things such as like the cancer summary. So what type of cancer, what stage, how old was the patient when they were diagnosed, the different treatments. Did they get chemotherapy? Did they get radiation therapy? What kinds of surgeries? Did they have to undergo like a transplant? What kinds of recurrence risk is there? What do we need to watch for? What other late treatment related risks are there, and how will we screen for those? So things such as, if there's a cardiovascular changes, are we going to be doing echocardiograms, or are we going to do thyroid ultrasounds or certain kinds of labs, and how often? What other surveillance and screening guidelines, what tests and when you'll need to get them done? And then just general lifestyle factors and wellness. So like before, focusing on like fatigue, exercise, nutrition, diet, those all kind of really impact on kind of the overall care of the patient as well. A lot of times these care plans are developed by different companies. So there's different companies that will use and develop these treatment plans and make them there. I put a few of them in here. I know at Moffitt we had been using, I think, the Journey Forward one through the American Society of Clinical Oncology, but there's multiple different ones. And sometimes institutions will develop their own care plans. But really, it's one where even through like a Word document or an Excel spreadsheet, you can develop a care plan even that way as well. Related to kind of nutrition, which I mentioned just a minute ago, just to add on to that and the guidelines for kind of physical activity. So a lot of people will ask like how to, is there certain foods to avoid, certain things to avoid? And really through the American Cancer Society, the ACS, they really just say like, kind of eating a well-balanced diet that has lots of, kind of variety, limiting high calorie foods and beverages, and if you're overweight or obese, trying to, promote a little bit of weight loss to maintain kind of a healthy weight. So there's really no specific diet. Some places will even suggest maybe more plant-based, which is definitely good because it has more of those limiting the high calorie kind of foods. But each person's a little bit different. And I always suggest, discussing kind of the best things during our survivorship visit, but also sometimes even seeing a nutritionist if that's possible too. And then like the activity that we mentioned earlier really depends on when the patient is able to kind of be as active as possible. They aim to say about 150 minutes of something aerobic to get your heart rate up during the week. But again, it really just depends because a lot of times patients, like we mentioned before, your exercise tolerance is really diminished. And so sometimes you have to have a stepwise approach to get there as well. So it's really, really, it's really important with things that we'll discuss during kind of these survivorship visits during related to these topics too. I brought this slide in here too, just to say about the primary care barriers. So I know there's studies that have shown that survivors feel more, comfortable sometimes in specialized or expert care with kind of cancer programs or cancer institutions. And sometimes primary care providers suggest they even lack the familiarity and kind of the history with cancer care too. But it's definitely one where primary care providers can be the kind of the person or the team that kind of takes on the survivorship role. And in some areas around the country, they actually do too. So it's definitely one where we want to work more closely with the primary care team so that way they understand the cancer treatments, understand what the risks are, and understand how to like monitor for those. Because we know sometimes it's really hard for survivors to come to multiple different visits. And if they're already seeing their primary care provider, is this something that they can also do when they're seeing them too? And so, yeah, partnering with the primary care during and definitely after treatment with good communication, the treatment plan, education, and understanding some of the resources available. And so I'll finish it up here with just a few take-home points. So we're seeing more and more cancer survivors and definitely more and more adolescent young adult cancer survivors. These survivors are at increased risk for a lot of different a lot of adverse health related outcomes. So things, related to different, mental health concerns, physical concerns, secondary cancers, lots of different health effects that they can happen. There are newer and newer therapies being developed that hopefully will minimize some of these kind of long-term health outcomes, especially if they're more individualized and especially if they can really decrease the risk for some of them by, removing a certain medicine or removing a certain treatment while still having the same ability to kind of get rid of the cancer. And there's lots of different kind of survivorship programs, and using them is really, really essential. And then making that connection with primary care so that way patients can feel that they're a part of their team as well and they understand what's going on. And maybe even take over that role of doing that monitoring so that way it's easier for the patients to kind of not have to go to multiple different centers to get the care that they need.
Thank you for viewing this session. We offer live adolescent and young adult Meet the Experts sessions through Zoom. And to view a list of upcoming sessions, please visit moffitt.org/meet the experts or call 813-745-1690.